All right, I'm going to show you how to thrive in 3 minutes in the temple area. Not an area easy to treat.
No, this is actually a very, important area, and historically we've gone down on bone with needle, and I feel like you don't really get a good surface coefficient of your product use when you do that. So I really love your technique. Walk us through it. So
I love when you tell me you love my techniques. Okay, so this is how I do the temple area.
I want to pause here real quick. So how did you choose this insertion point in the temple? So you're treating the anterior temporal fossa, so that's important.
Yes.
How are you choosing this insertion point?
Because from that insertion point, I can get all around the whole temple area, and I can get up to over the lateral brow using a 22 gauge cannula, 70 millimeters.
Okay, now you're using an expression gel here. Are you blending it?
So I will use express gel here, but most commonly I use a hyalocross that I mix 1 to 1. 1 cc of saline to 1 cc of hyalocross, and I'll inject a cc into each of my combination into each temple.
So 1 cc of blended product into each anterior temporal fossa.
Usually that 1 to 2 cc's.
And what plane are you injecting right now?
So
and how do you
I'm on the
know that you're in
superficial
that
layer of
plane?
the deep temporal fascia. And how do I know I'm in that layer? Experience. And it's a feel thing. And I know
superficial layer? I thought you were in interfascial.
I'm on the superficial layer of the deep temporal fascia, which is an interfascial plane.
Interfascial plane, basically where the roof of your plane is the superficial temporalis fascia.
Yes.
And the bottom of your plane is, it's basically like the laminary, it's like the intermediate laminary fascia, right?
We call it the superficial layer of the deep temporal fascia. The deep temporal fascia has 2 layers.
Yes, the superficial lamina of the deep temporalis
and this
fascia.
is a plane that it's avascular. And I'll tell you, one of the tricks to knowing you're in this plane is as I'm in there, I can actually see myself under the vessels. So the vessels are atop me. So there's big veins
the artery,
there.
the superficial temporal artery is also above you because
Yes.
it runs in the superficial
Yes.
temporalis fascia.
Yes.
And then your reticular veins are definitely above you
Yes.
because those run within the subcutaneous fat plane, the superficial subcutaneous fat plane of this fascia.
Yes,
Okay.
and when I'm in this plane, I'm pushing forward, I'm injecting product as I push forward a little bit, and the space kind of expands, and then it pushes the vessels away, and then once I get in there, it gets a lot easier, and it can just expand it more. And the beauty is that this is a continuous plane.
But right here, you're dancing with the sentinel vein.
Yeah, I want
because that sentinel vein pierces through the superficial temporalis fascia. So
yes, it does.
How do you confirm that you're not there?
Well, I work around it, so it's exactly right. I know exactly where it's at. It's about a centimeter lateral to the oral rim, and I'm working around it, and I bounce off of it sometimes, but I don't really go right at it. I won't stab at it. Okay. And sometimes if I get stuck and I can't get the cannula through easily, which doesn't happen that often, but sometimes it does, especially if someone's had surgery in the past or they've had energy-based devices, I won't go into it. I'll just deposit product, and then I'll use my hands to massage the product into the whole area.
Which is what you're doing right now, and look how it supports and lifts her brow when you do that.
That's one of the most amazing things. I can come under the brow and I can lift the brow.
And it picks up all that redundant cutaneous skin also of her upper lid.
Yeah.
It looks amazing.
Well, thank you very much.
And minimal swelling, minimal bruising, minimal so you're not dancing. You don't have to worry about the anterior and posterior deep temporal arteries that are also, really right above the bone. And some people on bone, like me, so you definitely wouldn't want to go down on bone using that 1-to-1, one up, one over, because there have been cases of getting into the anterior deep temporal artery.
And also the bone, if you're on the bone, there is little tiny, sinuses or holes in the bone. You can get into the
cranium,
yeah.
Which has also been reported.
So you have to be much more careful than you think when you're on the bone. You really have to aspirate. I think you have to use a lot more product. I really think this is a great technique for this. It takes a while to get the feel, but once you get that feel, I feel super comfortable. And I don't even like using ultrasound because ultrasound is a kind of it
well, yeah, you and I did ultrasound together. I use ultrasound at least to kind of confirm that I'm in that plane, but then you definitely are seeing the superficial temporal artery right above your product, and that can be a little disconcerting. So you can go based on feel, but for those that want to confirm that their feel is truly that you're in that plane again between superficial temporalis fascia and the superficial layer of the deep temporalis fascia, which is different than the layer between, which is also interfascial, which is if you have the superficial layer of the deep temporalis fascia and the deep layer of the deep temporalis fascia, there is a fat pad there, but you do have an artery that runs through there.
Okay, a couple of things is some people talk about doing it in the subcutaneous layer, and you know we've talked about this before.
Right.
And to me, that's a risky area because I've seen people get into vessels many, many times. But Cotafono and Gabby Casabono talk about getting a lift, and I do think you can get a lift if you stay.
You have more product you have better product coefficient utilization if you do it more superficially.
But I think you're at high risk for getting into a vessel, so I'm not a big fan of doing that.
And you do have your reticular veins that we laser commonly with a long pulse 1064, and you can laser the veins before you inject that plane to minimize bruising, but I definitely believe that you can get more bruising if you are running in that subcutaneous.
So that's really superficial.
Superficial fat pad.
The other thing you can do is you can palpate the artery,
Yeah.
feel where it is, and you can mark it out beforehand. It's very easy to palpate on yourself or anyone else.
So there you have it. Now
Wait,
you know.
a couple of things. It lasts like 2 years or longer. Your longevity here is incredible.
Yes, when you do inject, I feel in that interfascial plane, it does last longer than if you inject on bone with less product.
Yes, and also sometimes during surgery, I'll inject this because I'll get results as good, if not better, than anything surgically I do in this area.
So you use HA product instead of fat.
I won't use fat because I think fat can get lumpy there. It's
I
really
do
hard to
see
fix.
fat get lumpy, and usually when you inject fat, they're injecting in the superficial fat plane, right? Not interfascial.
They could go into the interfascial plane,
Okay.
but I don't think the results are as good with fat as they are with HA for me, so I'll use HA during surgery.
Yeah, at the local facial plastic surgeon that I send to sometimes when somebody needs a lot of product in this area, interfascial, chooses HA over fat.
So overall results can be fantastic here. Cosmetically, really impressive results you get with this area. Lifting the brows, you just have to be careful. I think technique is important here, and I think you need a little bit of experience. It's not a beginner's treatment.
And definitely 22 gauge cannula, because 25 will definitely pierce. Remember, the likelihood of your cannula piercing an artery is always dependent on the size of the artery, and the superficial temporal artery is one of the largest arteries that we have that we're dancing with on the face.
Agreed.
All right.
Thriving
I like
at
it
3.
when you agree.
Yeah. Thanks for watching, and please hit that like button.
And make sure to click on subscribe so that you can stay most up to date on all things thriving.
Like me?
You need to subscribe.